Welcome into today's hot news. Ladies and gentlemen, in the past 24 hours, the world has recorded 593,252 cases of COVID-19 and 11,178 deaths. The total number of SARS-CoV-2 virus infections globally increased to more than 69.1 million. According to statistics from worldometers.info, the total number of new strains of coronavirus, SARS-CoV-2, causing acute respiratory infections, COVID-19, globally was 69,162,610, of which 1,573,707 people died. Up to now, epidemic diseases have appeared and spread in 218 countries and territories. Countries also recorded 47,928,158 patients with treatment. The number of critical cases is 19,671,236 and 106,169 cases are under active treatment. On December 9, the world had 145 countries and territories recorded new COVID-19 cases. 102 countries, regions suffered from pandemic deaths. Compared with the past days, the number of deaths and new cases in many countries in the world recorded in the past 24 hours increased sharply. The COVID-19 epidemic has complicated developments in many countries, such as the US, India and Brazil, and has spread widely, with the number of cases of cocoa being infected in many countries, especially in Europe. Worrying disease developments have reappeared in some parts of the world, after a series of countries faced a new outbreak. The United States is still the country most affected by the COVID-19 pandemic, with a total of 15,782,424 million cases and 295,861 deaths, respectively. Behind the United States is India with 9,762,326 cases of COVID-19 and 141,735 deaths, followed by Brazil with 6,728,452 cases and 178,995 deaths. In the past day, the U.S. witnessed sad records when the number of new cases in the country in a row within a week always stood at approximately 200,000 cases, while the number of deaths, they also maintained at over 2,000. In Europe, in the complicated situation of COVID-19 epidemic, the Belgian government stipulates that from December 18, all people entering must make a mandatory medical report. In particular, those who were in the red zone for more than 48 hours when entering Belgium had to quarantine themselves for 10 days and should be tested for SARS-CoV-2 virus on the 7th day of isolation. In the Netherlands, the COVID-19 epidemic is also heating up, forcing the country's government to extend social restrictions until the end of the year-end holiday. Accordingly, the Netherlands extended a month, to January 15, 2021, banning families of more than 3 adult guests to play at home, while restaurants and bars remain closed. Meanwhile, Sweden also decided to extend the ban on gathering of more than 8 people in public until the end of Christmas and New Year. In Germany, Chancellor Angela Merkel has called on people to limit their exposure during Christmas to effectively control the COVID-19 epidemic. In addition, she also asked the German parliament to consider a large-scale blockade after Christmas, supporting the closure of schools and shops until January 10, 2021. The German health authorities said on the morning of December 9 that in the past 24 hours there had been an additional 20,815 new infections and 590 deaths caused by COVID-19, the highest number of deaths per day since the beginning of the epidemic. According to statistics site worldometers.info, as of this moment, Germany has a total of more than 1.2 million infections and 20,259 deaths caused by COVID-19. On the same day, Moldovan Prime Minister Boris Haria announced that Prime Minister Ryan Ciucu had a positive result for SARS-CoV-2 virus. During this time, Prime Minister Chika will run the government remotely. On December 9, the first COVID-19 test flight departing from New York City, USA, arrived in Rome, Italy. This is an initiative launched to reopen air routes between Europe and the US that are currently stalled due to the impact of the epidemic. All 100 passengers present on this test visit are required to present a negative test report for SARS-CoV-2 virus 48 hours prior to boarding Alitalia's flight at John F. Kennedy Airport. And this number of passengers continued to perform another test when they arrived at Fiumicino Airport in Rome. According to the AGI news agency, this allows passengers to not have to comply with the 14-day quarantine regulations similar to other cases of entry into Italy from the U.S. According to airport officials, all passengers on this flight still have to wear a mask and change to a new one after 4 hours of use. In Asia, on December 9, the Indian Ministry of Health rejected the news of some media outlets that the Pharmaceutical Regulatory Authority of this country had rejected the petition for the emergency license to use the COVID-19 vaccine. Potential Covishield was developed by the pharmaceutical firm AstraZeneca and a vaccine developed domestically. Earlier that same day, TV channel NDTV and CNBC TV18, India, reported that the Central Pharmaceutical Quality Control Organization, CSCO, of India is still looking for additional data from pharmaceutical companies. After reviewing the marketing authorization petition filed this week. According to NDTV, both licensing petitions were not passed due to insufficient data on the safety and efficacy of the product. The Indian Ministry of Health has denied the above information. Meanwhile, the Reuters news agency, citing a source concerned, directly said it was too early to talk about whether or not to reject the petition to license circulation of vaccines. Another source said CSCO only wanted more data on safety and efficacy of a product before making a decision. This source emphasizes that this is part of the licensing process. Previously, on December 8, the Indian government announced that some potential vaccines could be licensed for use in the next few weeks. In Korea, the Korea Agency for Disease Control and Prevention, KDCA, recorded 686 new infections on December 9, of which 662 were in the community, bringing the total number of cases in the country up 39,432 cases. Statistics of KDCA also show that the number of infections with unknown source accounts for 26%. In particular, this month, up to 4% of people tested positive for the SARS-CoV-2 virus but had no symptoms, increased 4 times compared to 2 months ago. Facing abnormal developments, the Korean government decided to apply 2 new COVID-19 test methods with a remarkable improvement compared to current testing methods. It is the Rapid Diagnostic Test, RDT, which detects viral antigens, and a saliva test. Regarding the vaccine problem, on the first day of the UK implementation of the vaccine program COVID-19 vaccination of Pfizer-BioNTech, the country has recorded 2 cases of allergic reactions. UK authorities immediately recommended that people with a history of allergy should not get the COVID-19 vaccine at this time. Meanwhile, Israel received the first batch of vaccine under a contract already with Pfizer-BioNTech. Prime Minister of Israel expressed optimism that the epidemic will end soon and he will give the first shot. According to the website worldometers.info, as of 23:59 p.m. on December 9, the countries of the Association of Southeast Asian Nations, ASEAN, recorded 9,870 more cases of COVID-19 disease compared to a day ago, while the total number of deaths increased to over 29,540 people. In the past 24 hours, the ASEAN Association had 4 countries that recorded COVID-19 deaths: the Philippines, Indonesia, Malaysia, and Myanmar. Indonesia is still the most serious outbreak of COVID-19 among ASEAN countries, with the highest number of new cases and deaths in the region. The epidemic situation in the country of thousands of islands continues to be serious after several months of outbreaks here, and there is no sign of cooling down. The Philippines epidemic is still going badly with the third largest number of new cases per day among Southeast Asian countries, but the number of deaths continues to be well controlled in recent days and is on the way to cool off. The situation in Malaysia is also becoming more and more worrying. A new wave of epidemics is coming back to Malaysia when it recorded 959 new cases. In the past one day the country also saw 5 new deaths from COVID-19. Myanmar's epidemic diseases are also becoming more and more complicated with the increasing number of cases and deaths every day. The situation in this ASEAN member country is currently very worrying with 1,427 new cases and 23 deaths from the SARS-CoV-2 virus in the past day. Specifically, the SARS-CoV-2 virus has so far claimed the lives of a total of 29,542 people in Southeast Asia, an increase of 206 cases from a day earlier, while the number of cases increased to 1,280. 896 cases. Besides, the ASEAN region also witnessed the number of patients successfully treated was 1,107,025 cases. The whole bloc is witnessing the epidemic developments of concern, complexity and potential risk of outbreaks of new epidemics in many member countries. In the past 24 hours, ASEAN had as many as 8 member countries recording new cases of COVID-19. Only Timor-Leste, Laos and Brunei are ASEAN countries that did not have any additional COVID-19 cases on December 9. In Australia, scientists at the Garvan Institute for Medical Research and the Kirby Institute at the University of New South Wales, UNSW, in Australia have pioneered a new gene sequencing approach to the SARS-CoV-2 can determine the path of the virus in 4 hours, instead of the standard 24 to 48 hours. This superfast gene sequencing method has been applied by scientists at the 2 institutes in New South Wales, NSW, and will be deployed throughout Australia in the near future. The above method, known as nanopore sequencing, helps health authorities to quickly track how SARS-CoV-2 infections are linked, triggering timely quarantine close contact person and minimize other risks. Using nanopore devices, the team can produce the final genome sequence as fast as 2 hours, says Ira Devson, head of the Genomic Technology Group at Garvan's Kinghorn Clinical Genome Center. Receiving amplified DNA of SARS-CoV-2 virus from an infected case. The nanopore sequencing device is about the size of a cell phone. The DNA strands are passed through tiny sensors to measure electric current. The resulting signal is decoded to provide a specific DNA or RNA sequence. Dr. Devson judges this method to be affordable, portable and does not require the necessary laboratory infrastructure like today's standard pathogen genetic tools. There are concerns about the accuracy of the nanopore sequencing method, but scientists from the Garvan and Kirby Institute have published a paper that clearly analyzes how the SARS-CoV-2 virus genome sequenced. Published in Nature Communications, the article not only demonstrates the high accuracy of this superfast sequencing method, but also provides best practice guidance to other Australian hospitals and laboratories and widely applicable in the world. This news has closed our news program. Thank you for always watching until the end of the video. Do not forget to subscribe to the channel, share, and leave your own views below the comments, to continuously update new information. The most accurate comes from us. And now, goodbye and see you again.